Hello! Today is the day that I'm doing my injection again. The day that I take my Humira medication again for Crohn's disease. Humira can be taken for any autoimmune disease, rheumatoid arthritis, Crohn's, any I imagine, where your immune system attacks itself and causes an illness. So I'm very happy to finally be on this drug. It's probably the best one out there for Crohn's, and it's pretty simple to do. You have either an injection or a pen. I've chosen a pen just because it seems a lot easier, and you fortnightly inject yourself and you're good to go. So it's convenient, you don't have to go to the hospital, you just get it delivered to your house every couple of months, store it in the fridge and do your own treatment, which is fabulous. So, these are the pens that you get. I'll just put the lids back on so I can show you properly. So you get sent pre-filled syringes like this. You do a couple of checks. You basically check in this little window there that there's one full air bubble. You know, you may think that it hasn't dispersed, that it's not frozen, and that it's safe to use. That's one check that you're making, just there. So you're checking the date, you're checking that it's safe to use. If there's any problems, you call up the Humira helpline and they will send you out another. It's our best to get it out of the fridge 15 minutes before you start if you can. That way it's less of a shock when it goes into your skin and it hurts less, basically. So you'll want to do that if you can. Okay, so first injection, let's do this. You can do it in either your stomach or your thigh. I personally prefer my thigh. I don't suppose any feels worse than the other, it's just your preference. However, you do need to rotate every time you do your injection, so now that I'm doing them in my thighs, in 2 weeks I'll have to do them in my stomach. So you're aiming for the top of the thigh and you're avoiding the joints and the outer or inner. Let's go for the top, most fattiest part of your thigh basically. And what you do is you take number 2 of the pen, which exposes the bottom, and you take number 1, which you can't see any needle at all, which is good for those, especially with needle phobias. You can't see anything at all. Okay, so what you do is you pinch a little bit of your thigh to raise it, place it onto the thigh so that this white area is pressed into your thigh and you can no longer see it, so it's into the skin like that. Okay. And then you brace yourself, but try to relax. It hurts a little bit obviously, but it's 5 seconds. You just hold it, press the button, count to 5, don't pull it out, leave it pushed in. Our automatic reaction is to pull it away, but you have to not do that. Just keep it pressed into the skin, otherwise it's not going to work. You're going to waste your pen, you'll have to do it again, and you're more than likely just going to bruise and bleed. So it pays to just do it properly the first time and to just not think about it. Just think about that you want to be healthy and that it's worth it. So pinch your skin, press it down into the skin. Then press the... I'm too scared to do it myself even now. Just pinch the skin, press it in, press the button, hold it in 5 seconds and then pull it out and it's all done. It lets you stronger than yesterday's some motivation. Okay. Pinch your skin, press it in. Too scared to do it. I have to get used to this. When I'm used to it, I will be able to do it like that every week, but this is only my 2nd time. This is my 1st time doing it without the nurse here, so I have to psych myself up a bit, but last time I just thought, get it out of the way. the sooner you do it, the sooner it's over, so let's just do it, right? Okay, so pinch the skin, press it into the skin. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, just to be sure. Loose the skin. And then pull it off. There we go, it's all done. And I'm bleeding a tiny little bit, just like a pinprick, nothing much to notice. Put the lids back on and into the vinegar. Now, that was a little bit painful because I forgot, when you do pinch your skin, as soon as you press the button, loose the pinch, because that then lets the liquid disperse without it hurting as much. That was more painful than it should have been. That's my second one in my other leg. Same process, take it off, do your checks, check the little window, check that there's an air bubble, that it's not frozen, that it's not clouded or discoloured, and that the air bubble is just one. Yeah, it would be very good if you don't have a dog around while you're doing this. Okay, so same process. Humira pen. Take number 2 off, the button. Take number 1 off, the injection. Squeeze the thigh a little bit. Squeeze the thigh a little bit. Press the white ring into the thigh area. Press the red button. Brace yourself, release the squeeze, count to 5. 1, 2, 3, 4, 5. Feel the sting and release. And voila! Perfect health. So that's it, I'm done for another 2 weeks, and from then on I've only got to inject myself once, so excellent. I love this system, it's fabulous. It's pretty much the same as infliximab, where you go into the hospital and you have infusions, only obviously this is a lot more convenient. You don't have to take time off work, you don't have to sit in a hospital for 4 or 5 hours with a drip in your arm. 5 minutes and 2 minutes even once you're used to it, and you're done. So I recommend Humira for those of you with autoimmune diseases. It works for the majority of people. Obviously depends what other medications you're on, what you've been on before, but generally it's very, very good, so I highly recommend it. I'll be more than happy to give you any information that you like on the treatment or on Crohn's disease. I've had it since I was 15. I haven't had to have any surgeries or anything like that. I thankfully, touch wood, been fine on immune suppressants and, you know, infliximab and now Humira and steroids at the worst time. It affects your moods, it affects your skin, it affects basically everything, and you don't well, it's a relief when you've been ill for so long to get on the penicillin, but long term it's not something that you want to keep going on or it'll stay on, period, because it has far too many side effects. And not only that, but it gives you the well famous moon face, chipmunk face, which I've got anyway, so I don't need any help with that. So I'm glad that I can come off those now and I'm on something that works great.